My name is Dr. John McGrain. I'm a clinical oncologist at the Royal Cornwall Hospital, and thank you very much to the Patient Experience Network for shortlisting us for this award, and well done to everybody else. There's some brilliant presentations so far. I'm here to present the MySunrise app alongside George Brighton, who's one of the co-founders of the app. This was something that is a cancer companion app that came out of necessity, really. Whereby, in clinics, I saw that I was giving patients lots and lots of information, lots and lots of written information to take away, but there was this feeling that patients weren't given that opportunity to access the right information at a time that was suitable to them. And it's about trying to give patients some control back over when they interact with their information that this project was born. Next slide, please. I hear this an awful lot when diagnosed with breast cancer, this patient in particular, but could be any type of cancer. It's like joining a roller coaster at 100 miles an hour. Everything happens very quickly, and then the patient is in this kind of maelstrom of the treatment, and then afterwards everything goes quiet, and people are left wondering about who to contact, when to contact, or even as they're going into the journey, what that holds for them. So there's huge amounts of uncertainty. Next slide, please. And now more than ever, patients are needing support and information, both them and their families. Cancer treatments are becoming increasingly complex. Our patients themselves have higher expectations of what they want from treatment. And as demand increases, our services are being put under increasing pressure. And if we look at the 2019 and 2020 Macmillan survey, 25% of patients at that time, of the 70,000 patients surveyed nationally, felt that they didn't have their side effects for treatment discussed fully. 39% of patients felt they didn't have long-term side effects or consequences discussed, and 10% of patients wanted more information on self-help or support groups but felt they couldn't access it. And the key thing about this was before COVID. This was at a time when we had a huge amount more footfall in appointments, people coming to see you in the department. As we've heard numerous times during this COVID time, there's been a big switch to patients being reviewed remotely, so there's much less face-to-face contact. And whenever I show this data to colleagues, they all say, but patients get told this. But it doesn't matter what we tell them. If they're not hearing it or they're not accessing that information at the right time, then we're not doing them the right service. So that's why MySunrise was born, to try and give people the opportunity to take something in their hand, like their phone, and review the information at a time that was right for them. It's designed working with the cancer centre. So we're now open in 5 cancer centres. It started here in Cornwall and has now been adopted by 5 adjacent cancer centres, or 4 adjacent cancer centres. So we've got a network of trusts using it. It's got trust-specific, up-to-date information that's relevant to the patient about their cancer service and their cancer pathway. They can see parts of it that relate to their cancer pathway, and that is something that we are delivering more in the coming months based on feedback from our patients. We have worked very closely with patients, and indeed, as part of the project, we have established patient champions in each of the sites that we develop, because much of the development and the directions of progress have been dictated to us by the patients. And there's no point making a patient app and then dictating to them what goes on it. We've put in videos, and those videos are often shot in patients' own cancer centres. So there's a kind of familiarity to them, but it's help and support on things like chemotherapy, like immune treatments, like radiotherapy, which is often very daunting. But patients, it's a very popular aspect of it, of the app, that patients keep coming back to. It also allows the patient to connect to the video consultations, and it has been hugely important during coronavirus. When the app was initially opened in Cornwall in 2018, we've got some experience, and developing it and delivering it for patients. But then when it went across the other 4 trusts, then the coronavirus outbreak hit. So we put in a coronavirus section to keep patients up to date with what was happening in each of their cancer centres. And that was very popular and proved a big bonus for a lot of patients. Next slide, please. Why? Well, it's personalised to each of our patient cancer centres, and the patients absolutely love that, the fact that it is relevant to them. After feedback from our patients, we're further developing it and making the ability for the app to be specifically for each cancer type of the main cancer types, so that every piece of information is relevant to that patient. The contact details are very important. We give out lots of pieces of paper, but patients constantly say to us, they don't know who to contact. So we're trying to signpost them, not just who to contact, but when to contact that person, so that patients have that extra support with them. We're keeping it up to date, and it's to try and help patients stay in control. Can we just, next slide, please? So the features that we have currently, we've got the coronavirus update still running because we're still with that. The cancer centre, complete with videos relating to that. The treatment section, which is very popular, as you might imagine, showing information on and videos about the treatments and when to contact and what to look out for. The new pathway section, which is coming soon, and symptom support. That's giving patients advice on common symptoms and side effects from cancer-related problems, and then signposting them to what they can do to try and help with that or when to contact. And that's being evolved further on the back of our surveys and patient feedback, where we're building in a wellness tracker where patients are wanting to kind of monitor their mental and physical well-being and feed that back. And in the contact section. Next slide, please. So we've had really good traction so far. We started in 2018 here in Cornwall, and then that launched and very successful, very popular, and recognised and won one or two awards. And then that has branched out to the adjacent trusts. And then we have done some work with our Southwest Academic Health Sciences Network to kind of build on that survey, and we've got a survey of 300 patients giving us feedback on how they felt information was delivered to them during the coronavirus outbreak, which was really important and really interesting, and also feedback on how the healthcare teams felt the information was transferred during that time. And we're putting that together, and we've made a report for that, and that's in writing for publication. George will talk a bit later about what we're doing in terms of an NHSX digital case example, our new pathways, and we've got this new version with the pathways and the wellness tracker ready to roll out to the cancer centres. If we look at the next slide. Next slide, please. One thing that people keep saying to me is, well, what are people getting out of it? When we surveyed their first 100 patients, patients consistently reported that it improved their anxiety. They felt they got better access to local information. They felt more in control and had a better experience as a result. And if we look at the users, it kind of debunks that myth that elderly people won't engage. 60% of patients are over 60, and we've got a substantial number of people over 70 and into their 80s. 75% of patients report reassurance and confidence. 1 in 6 our users are relatives, which is actually very important to help them feel involved. 94% of users recommending the app, and 92% finding it easy to use. I'm going to hand over to George for the last minute because I've talked too long.
Thanks, John. Well, just to reiterate, when we first started this in 2018, it was really simple. We had simple information leaflets and information about videos, and specifically for cancer patients that they receive when they start their treatment. Over the last couple of years, it's really grown, and we've got a lot of traction, and we've really kind of understood, I think, what staff have told us about what's useful, what patients have told us about what they like, and we've really been able to refine it specifically for cancer patients as they start their treatment journey. We've also done a case study looking at what the provider benefits are, so some savings in time per cancer specialist per appointment, fewer appointments. We've been able to push patients towards more virtual appointments, so there's a link in the app to their video consults. And through COVID, that's been really popular and fantastic to be able to offer that. We've also been able to show some reduction in paper costs and even possibly some reduction in the number of scans. So that's been a real benefit to the provider. So next slide. Looking at the data, I mean, we've been seeing around between 70 and 100 sessions per day, and we've had nearly 2,000 downloads since September, so in about a year. And bear in mind, those are small numbers, but remember that these are all patients that are on cancer treatment, and so they're a really important group that we've been able to target. We've been able to look at the data and show what the popular sections are, and we've also been able to integrate a cancer survey, which has been really useful. So we've had 300 cancer patients complete that survey, and from that information, we've been able to put together this phase 3 work that we're doing at the moment, which is specifically cancer-specific pathways. So patients have told us they love the app, they love the fact that they can contact their CNS through it, that they can watch videos about treatment, but they want specific information about prostate cancer or breast cancer. And so what we're doing at the moment is specifically along those lines for cancer-specific pathways. So